Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 22nd lecture on systemic pathology. Today, day 3 of diseases of salivary gland. Day 3 of diseases of salivary gland. Dear audience, in day 2, I have discussed briefly about the pleomorphic adenoma of the salivary gland. Today, adenolymphoma and mucoepidermoid tumor. Today's topic is adenolymphoma and mucoepidermoid tumor. First come to adenolymphoma. Dear audience, adenolymphoma is one of the monomorphic tumor of salivary gland. It is one of the monomorphic tumor of salivary gland. This tumor is composed of cyst-like or cleft-like spaces and lymphoid tissue. This tumor is composed of cyst or cleft-like spaces and lymphoid tissue. Adenolymphoma, one of the monomorphic tumor of salivary gland, composed of cyst or cleft-like spaces and lymphoid tissue. Dear audience, now come to histogenesis of adenolymphoma. Histogenesis of adenolymphoma. Histogenesis of adenolymphoma is not clear. It is not clear. But it has been suggested that it is derived from a remnant of embryonic branchial cleft. It has been suggested that it is derived from remnant of embryonic branchial cleft. The lymphoid tissue is considered as the accumulation of reactive lymphocytes. Lymphoid tissue is considered as the accumulation of reactive lymphocytes. Dear audience, adenolymphoma is a monomorphic tumor of salivary gland. The histogenesis of it is not clear. It has been suggested that it is derived from the remnant of embryonic branchial cleft, and the lymphoid tissue of this tumor is considered as the accumulation of reactive lymphocytes. Dear audience, now come to morphology of adenolymphoma. Gross examination reveals the tumor is small and round to oval shape. Small tumor with round to oval shape. Dear audience, we can recapitulate. Pleomorphic adenoma is a lobulated mass. Microscopic findings: if we do FNC of this mass, what will be the findings? We are talking about adenolymphoma of salivary gland. FNC reveals columnar epithelium with eosinophilic granular cytoplasm. In addition to columnar epithelium with eosinophilic cytoplasm, lymphocytes. Dear audience, we are talking about adenolymphoma. So, FNC reveals columnar epithelium with eosinophilic granular cytoplasm and lymphocytes. Cut section of adenolymphoma reveals cysts or clefts filled with mucinous fluid. Cut surface reveals cyst-like space or cleft-like space filled with mucinous fluid. Dear audience, if this is the adenolymphoma, if we cut this, we will get like this. Within this cut surface, there is a cleft or a space like, and this space is filled with mucinous fluid. This is the cut section. Histopathology reveals cyst-like or cleft-like space lined by columnar epithelium with eosinophilic and granular cytoplasm. This epithelium containing eosinophilic and granular cytoplasm is known as oncocytic epithelium. These are called oncocytic epithelium. In addition to the cleft or cyst, beneath the lining epithelium there is lymphoid tissue. Beneath the lining epithelium lymphoid tissue. Sometimes the aggregated lymphoid tissue reveals germinal center. Sometimes the aggregated lymphoid tissue shows germinal center. Suppose this is the cleft-like or cyst-like space lined by columnar epithelium, and the cytoplasm of the columnar epithelium is eosinophilic and granular. This is the nucleus, and these cells are called oncocytic epithelium. Beneath this epithelium there is aggregated lymphocytes. These are lymphocytes. This is the histopathology of adenolymphoma. Dear audience, adenolymphoma is a monomorphic neoplasm of salivary gland. Histogenesis of it is not clear. It is suggested that it is derived from the remnant of embryonic branchial cleft, and the lymphoid tissue is considered as the reactive lymphocytes. On gross examination, it is round to oval small mass. Cut section reveals cyst or clefts filled with mucinous fluid. FNC reveals oncocytic epithelium and lymphocytes. Histopathology reveals clefts or spaces lined by columnar epithelium with eosinophilic and granular cytoplasm. These are called oncocytic epithelium, and beneath the lining epithelium there is aggregated lymphocytes. This is all about the adenolymphoma briefly. Now come to mucoepidermoid tumor. Dear audience, mucoepidermoid tumor ranges from benign to malignant. It ranges from benign to malignant. It is composed of squamous epithelium, mucin secreting epithelium, and also intermediate hybrids. So it ranges from benign to malignant mucoepidermoid tumor. This tumor is composed of squamous epithelium, mucin secreting epithelium, and intermediates of hybrids. Dear audience, now come to morphology of mucoepidermoid tumor. Gross examination reveals a small round to oval mass. Gross examination reveals a small round to oval mass. Cut section reveals cyst-like spaces filled with mucinous fluid. Dear audience, if we cut the mucoepidermoid tumor, cut section reveals cyst-like spaces filled with mucinous fluid. Microscopic findings. FNAC reveals squamous epithelium and mucin secreting columnar epithelium. Dear audience, these are the squamous epithelium and these are the columnar epithelium mucin secreting. This is the FNAC findings of mucoepidermoid tumor. Dear audience, now come to histopathology. Histopathology reveals squamous epithelium and columnar epithelium as sheets or as cords. So, histopathology reveals squamous epithelium and columnar epithelium, and the cells are arranged as sheets or as cords. This is the histopathological findings of mucoepidermoid tumor. Dear audience, mucoepidermoid tumor ranges from benign to malignant. Grossly, it is a small round oval mass. Cut section reveals cyst filled with mucinous fluid. FNAC reveals squamous epithelium and columnar epithelium. Histopathology reveals squamous epithelium and columnar epithelium as sheets or as cords. Dear audience, today I have discussed about the adrenolymphoma and mucoepidermoid tumor briefly. Today up to this, thanks all.